What is up, guys? We're gonna be palpating Ryan and his knee. Okay, so first things first, we got the knee here. We got the condyles, medial and lateral condyles of the knee, and then the epicondyles are just superior of the other normal condyles. The trochlear groove is in here, so if I have him bend his knee and then extend it, I should be in the groove. Yep. And then we got the MCL and LCL. So MCL is the medial collateral ligament, and that'll be in this region here. And we got his LCL over here, the lateral collateral ligament. And then we got the Gertie's tubercle, which is on the lateral aspect, and it's over here, just under the LCL. And then we got the tibial tuberosity, which is pretty prominent on that shin. And then we got the patella, which is the main knee landmark. And we got the patellar tendon, which runs inferior to the patella. We've got the patellar pulse, so we got the superior patellar pole and then the inferior patellar pole. We've got the pes inserinus, which is on the inside, and it's like a bursa over here. And then we've got the head of the fibula, so the fibula will be on the lateral side, and it's just over here. You can kind of pinch it. And then you've got the actual fibula, and then we've got the tibia, which is the more prominent, stronger, medial, larger shin bone. Alright, now we are moving on to the musculature of the knee joint. Starting off strong, we've got rec fem, a major knee extensor. Okay, rectus femoris also does a little bit of flexion of the hip, and it also does some anterior pelvic rotation. You can find rectus femoris if you just literally palpate down. And then the next muscle we have is vastus lateralis, so that'll be on the lateral side of the thigh, and this will just be involved in extension of the knee. Thank you. And then the next one, we go into the intermedius, which will be along here, and it will be just deeper than the rec fem, but it also just does extension of the knee. We've got the medialis, which is that soccer kick muscle, that gives us that teardrop. We've got the extension of the knee as well. Boom, bam. Okay, so now we've got the hamstrings, and we'll have them flip over. All right, the hamstrings are involved in flexion of the knee. Demonstrate, thank you. It also does extension of the hip for semitendinosus, so that'll be running along here, that medial area of the thigh. And semitendinosus is flexion of the knee, extension of the hip, internal rotation of the hip, internal rotation of a flexed knee, and posterior pelvic rotation. Next we've got semimembranosus. And semimembranosus will do flexion of the knee, extension of the hip, internal rotation of the hip, internal rotation of the flexed knee, and posterior pelvic rotation. Next, we've got that major biceps femoris muscle, and this one as well, flexion of the knee, extension of the hip. This one does external rotation of the hip and external rotation of the flexed knee, as well as that pelvic posterior rotation. And then we've got a little muscle here that goes originates at the lateral condyle of the femur and inserts into the medial surface of that tibia. And this popliteus is doing flexion of the knee and internal rotation of the flexed knee. And then the last muscles we've got are the gastrocs, which are those calf muscles, and these help with plantar flexion. The gastrocs also can do be involved in that initial movement of flexing the knee. I almost forgot, but two other hamstring muscles that do flexion of the knee will be sartorius, which is that longest muscle in the body, and then also gracilis, the skinny one. Hamstring.